Hello and welcome, I'm Chris from the RCGP. If you're watching this video, you're considering a career in general practice, which is fantastic news. All GP specialty training ST1 programs in the UK are recruited to by a national process, which is managed by the GP National Recruitment Office, otherwise known as the GP NRO. The GP NRO have a fantastic website, which lists all of the information you may need when wishing to apply to GP training. On there, you will find recruitment timelines, and it will list the 3 application rounds for GP training every year. Firstly, round 1, secondly, round 1B, and finally, round 2. On the GP NRO's website, you will find plenty more information about how to apply to GP training. You can find things about fellowships, whether that's ACFs or Global Health Fellowship. It will give you information about recruitment leads and program details in each of the regions across the UK. If you've got any specific questions around deferment, completion ratios, any kind of targeted enhancement recruitment schemes, that information is all on there. So please do go check out their website, which you'll be able to find at gprecruitment.hee.nhs.uk. I'll quickly run you through the 3 stages to applying to GP specialty training as an F2 doctor. So here goes. So stage 1, the application form. Applicants are only able to submit 1 application per round for a standard GP ST1 training program in the UK, and you'll do so via Oriel, the online portal. The application form will ask for various information. Firstly, personal information, such as your date of birth, your name, etc. Any previous jobs, posts or experiences that you've had, whether you have a criminal record, you hold a driver's license, etc. Key qualifications, such as your ALS certificate, and where you wish to train, your preferencing. At the time of application, you'll be asked to indicate your preferences from all GP training programs available in the UK, and you'll do so in rank order. This means you can be considered for appointment across the whole of the UK. Please note, only preference programs that you'll be prepared to work in. Applicants are advised to read up about the areas they're considering training in. It is recommended that you research not only the types of programs offered in each region, but also the geography of each region. Consider things such as transport links, distance from work to home, etc. The ability to record your preferences will be locked at the point of application submission. However, you will be presented with a further window to continue preferencing. This window will start from the date you're invited to the Multispecialty recruitment assessment until 48 hours before the first offers are made. These dates are published on the GP NRO website for all relevant rounds. The training programs that you will preference in your application will be used to make you an offer, subject to the successful completion of the selection process. Stage 2. This is the Multi-Specialty Recruitment Assessment, and it's a computer-based assessment which is currently used by several specialties for entry to postgraduate medical training, such as general practice, psychiatry, radiology, obs and gynae, to name a few. There are 2 paths to the MSRA: a professional dilemmas paper, followed by a clinical problem-solving paper. It is a high-stakes test. In other words, you have to pass in order to continue the application process. Both parts of the assessment are designed to assess foundation-level competencies. The professional dilemmas paper is a situational judgment test, an SJT, and it provides scenarios in the workplace for applicants to demonstrate their judgment of the most appropriate behaviours in that context. Content directly relates to the generic professional capabilities framework, which is outlined by the GMC, and these are capabilities required by any doctor. It does not require specific knowledge of experience in specialty training, but does assume general familiarity with typical primary and secondary care work activity. The test aims to assess 3 core components: professional integrity, coping with pressure, and finally, empathy and sensitivity. The next stage of the assessment is the clinical problem-solving paper, which is a test of how an applicant can apply their clinical knowledge to make clinical decisions. It is based on the foundation program curriculum. Applicants are presented with clinical scenarios that require them to exercise judgment and problem-solving skills to determine appropriate diagnosis and management of patients. Please note, this is not a test of knowledge per se, but rather one's ability to apply it appropriately. Once you have completed these 2 stages, an applicant that scores highly enough and receives a direct access score will be exempt from the selection centre and will be successful in their application to GP training. Stage 3 is the selection centre. The selection centre has 2 parts, and to offer up reassurance, no clinical skills are assessed during this stage. You will begin with a 30-minute written paper, where you are presented with a similar professional dilemma to those in the MSRA, but this time a more detailed rationale behind your decision making is required. You'll be asked to rank each issue in the order in which you intend to deal with it, then to justify your decisions and describe what action you will take. Finally, you'll be asked to reflect on the challenges posed by this exercise. You'll then complete a series of simulated scenarios with the following individuals. Firstly, one will play the role of a patient. Secondly, a patient's relative. And then finally, one will play the role of a colleague. Each of these simulations will last 10 minutes. And throughout, you will play the role of an F2 doctor. Once you complete the selection centre, the final mark for all applicants is calculated by combining the results of both the MSRA and the selection centre. To give an applicant's final selection score, the professional dilemmas element of the MSRA and the selection centre scores are weighted at 40% each, and the clinical problem solving element of the MSRA at 20%. All offers will be made via Oriel by the GP NRO. Offers received in any other way will be deemed invalid. If you are made an offer, you will need to respond to this on Oriel. That concludes the application process to GP training. Just to recap, there are 3 main stages. Firstly, the application form. Secondly, the multi-specialty recruitment assessment. And then finally, the selection centre. All 3 components go towards your final selection score. For those wishing to apply to general practice training over the coming year, and perhaps those looking in the future, we wish you all the very best. Here at the college, we're here to support you every step of the way.